Coronavirus patients desperate for a cure, awaiting the results of studies on several drugs so they'll know which could work, including this one, hydroxychloroquine, one of the biggest studies so far at the University at Albany in New York. But there's a mystery about that study. Hydroxychloroquine has been heavily politicized. President Trump is a cheerleader for it.
We're having some very good things happening with it. It will be wonderful. It'll be so beautiful. It'll be a gift from heaven if it works.
But doctors say it needs to be studied first. On April 12th, New York Governor Andrew Cuomo gave a date to expect preliminary results from the Albany study, which is being sponsored by the state.
I think we're going to get actual reports on April 20th.
Yeah, we'll get some preliminary results back on April 20th.
But April 20th came and no preliminary results. The next day, Cuomo was asked about it again after he visited the White House.
Do you have any indication of what the state results have been? You said that they were being sent to Washington yesterday.
I do not know. I do not know.
The researcher says he'll be releasing final results as early as the end of next week in the hopes of helping COVID patients as soon as possible.
So we're hoping that by next week we will have reached the final phase of this study. I think this study is really important, and it's important that we quickly get to the final phase as fast as we can.
So far, the most recent studies have not looked good for hydroxychloroquine, the largest thus far at the Veterans Health Administration, 368 coronavirus patients. Those who took hydroxychloroquine had more than twice the death rate as those who did not. In a French study of 181 patients, hydroxychloroquine didn't work, and some patients taking it developed heart problems. Neither of those studies has been peer-reviewed or published in a medical journal yet. One small study, also French, had 20 study subjects and showed that patients had a lower viral load after taking hydroxychloroquine. But that study's methods have been questioned, and the journal that published it is reviewing it again. For coronavirus patients and their families, more waiting to see which drug might make the difference between life and death.